Most people think Plan F, G, and N are completely different insurance systems. They're not. They're just different levels of the same structure. What changes is what you pay up front versus what you pay during the year. In this video, I'm breaking down the actual differences so you know exactly which one fits your budget. And if you want Medicare explained clearly, I post twice a week. Let's begin. Plan F, Plan G, and Plan N all follow the same Medicare rules. They work with original Medicare nationwide. No network, no referrals. If your doctor orders a Medicare-approved service like an MRI, Medicare pays its portion and your supplement pays the rest. If you need a specialist, you see the specialist. No prior authorization required. This is why many people choose these plans. The structure stays consistent. You get the same benefits in every state and every county. So let's break down what makes each one different. Plan F is the most comprehensive of the three, but you only qualify if you are eligible for Medicare before 2020. It covers every Medicare gap, including the Part B deductible, which is the amount you pay before Medicare starts covering Part B services like doctor visits and outpatient care. That deductible is just over $250 annually. That means your doctor visits have zero out of pocket and your tests and procedures have zero out of pocket as long as Medicare approves the service. And those services must be medically necessary. Things like cosmetic procedures, routine dental, vision, and hearing aren't covered, so your supplement won't cover them either. This level of coverage makes the premium the highest. Many people keep Plan F because they prefer the predictability of paying a higher premium and avoiding bills. Plan F works like this: highest premium, zero surprises. Plan G is the most popular Medicare supplement today. The difference between Plan F and G comes down to one thing. You pay the annual Part B deductible, just over $250 for the year. After you meet that deductible, Plan G pays the rest of the Medicare-approved cost. Here's how that plays out. If you see your doctor in January for blood work, you might pay $150 toward that deductible. Then you go back in February for a follow-up, you pay the remaining $100 or so, and then you're done. Every Medicare-approved doctor visit, lab test, and outpatient procedure after that, Plan G covers the rest. The premium is usually lower than Plan F, and for most people turning 65, Plan G gives the best balance between monthly costs and year-round coverage. People choose Plan G because it makes sense. Pay one deductible early in the year, and then you're covered. Plan N works well for people who want a lower premium and don't mind small copays when they see the doctor. With Plan N, you pay up to $20 when you visit your doctor for an office visit, and up to $50 if you go to the emergency room and you don't get admitted. Here's a real example. Let's say you see your doctor 3 times a year, once for your annual checkup, once for a follow-up, and once for a minor issue. That's about $60 in copays for the year. If Plan N saves you $30 or more per month on your premium compared to Plan G, you come out ahead. Now about excess charges. This is where most people get confused. An excess charge happens when a doctor accepts Medicare patients but doesn't accept Medicare's approved payment amount. They can charge you up to 15% more than what Medicare allows. Most doctors accept Medicare's payment, so you rarely see this. But if you want to avoid it completely, you can check if your doctor accepts Medicare's assignment. Medicare has a care compare tool where you search for doctors in your area and it shows you which ones accept the Medicare approved amount. Plan N works really well if you rarely need to see the doctor and want the lowest premium. Most people I speak with understand the basics but feel unsure how to choose. The easiest way to compare these plans is to match the plan to how you budget. If you want total predictability, Plan F is a choice, but only if you qualify. If you want predictability with a lower premium, Plan G works best. If you want the lowest premium and low doctor usage, Plan N is also a strong option. But once you know what to expect, the choice gets a lot easier. Here's where people get stuck on the math. I had a call from someone comparing their Plan F to Plan G. They were paying over $50 more per month for Plan F. Plan G would save them that premium difference, and they'd only pay the Part B deductible once a year. When we ran the numbers, the annual premium savings were well over the deductible they'd have to pay. They didn't realize the premium difference was costing them more than the deductible they were avoiding. That's the gap most people miss. They focus on coverage and forget to compare the actual cost. You have to compare premiums and benefits to make a clear choice. Here's what to do next. Compare the premiums for F, G, and N in your zip code. Count how often you see the doctor. Then pick the plan that matches what you're comfortable paying. If you're already on a supplement, review your costs once a year to see if switching carriers saves you money without losing coverage. Now you know what to look for, and the decision gets a lot easier. If this helped, share it with someone planning for Medicare. Drop your questions in the comments. I read them all. And if you want a simple checklist you can actually use, grab the free Medicare Starter Kit in the description. And follow along. I post twice a week.